So how many of us are using central topography? Aditya, you have to put your hand down. Arul has to put his hand down. So what is central topography? So he gave me a topic and I said, okay, no problem. I'll speak about central topography. And then I find that central topography is an add-on feature in the IOL Master 700, which is a list price of extra 5 lakhs. So you buy the IOL Master 700 and then you get a central topography, um, which is a very, very nifty feature. And what it does is this. So if you look at the front of the IOL Master 700, you have those 18 points, isn't it? Till that comes, I will speak. I'll finish it off. So you have So you have those 18 points in front of the IOL Master 700, and it derives a K from that. And if you look at those points, they're there in 3 concentric circles. So each of those circles are 6 points. So there are 6 points. I have come to the next one. Yes. Thank you so much. Yes. So you have 3 rings of 18 points. Each of those rings consists only of 6 points. And what the machine does is it divides each of those rings into 3 zones, the red, the yellow, and the green, just for the color difference. But the red zone is actually data derived from one circular point, extrapolated into 3 subzones. Yellow is one circular telecentric point, one circle divided into 3. The software is guessing all this. So it builds it up into 9 zones. And then the SSOCT is used to find out the thickness in each of the cornea. So it puts the thickness back on the back of this front topo map. So the front topo map is derived by those points, and the thickness map is derived from the SSOCT, and then it gives you the axial power map. That's it. So it's a software add-on which takes no extra time. What's the beauty of this? Yeah, I have a problem here. I'm going one slide slower there. Is that normal? When I press here, it's not pressing there. Thank you so much. See, I'm learning something new each day. So it puts the thickness map on the back of the topo map, and then you get the axial power map. That's it. And you get a derived map similar to this. And this represents approximately the central 4 mm of the cornea. Now, if you look to the right, we all know this as a huge oblique cylinder with a steepening and an approximate crab's claw kind of appearance. So we know this is a pellucid marginal degeneration in the making. But if you look at the central topo of the Zeiss IOL Master 700, you will find that it's a very irregular one, and you can see an area of red which shows that there is steepening. So this is not normal. If you look at this particular patient and you want to see whether you want to put a toric lens, you'll say, yes, I will put a toric lens. But if you see the right-hand side, there is more steepening than in the left. So there's a little bit of irregular astigmatism there. And again, one more pellucid marginal degeneration where the inferior steepening is missed by the central topo. But if you review this patient, you will tend to evaluate them further. So the central topo is an amazingly good screening tool for a very large volume or for a good volume practice, which does a lot of refractive cataract surgery. Now, if you get a map like this, which is all even, showing oblique corneal astigmatism, you will say, go ahead, it's perfect. And if you do the full-fledged Galilei scan, or if you do a Cirrus or any of the standard Tomo or Topo, you will also get a normal scan. Now, that's a central topo showing the lazy 8 kind of a phenomena, where here you can see an enormous amount of inferior steepening. So it does identify abnormal corneas quite well. Here you can see on the left-hand side, it's not regular. Oblique astigmatism, inferior steepening. And you can see a nice cone forming up there in the Galilei G4. So if you use that central topo feature, you will identify the abnormal corneas. So here's one more patient. You can see on the left-hand side is a central topo. On the right is a full-fledged topo that we are used to. Again, another pellucid marginal degeneration. It shows up there in not being that regular. There is an irregular astigmatism and a skewing, which you can see in the central topo. Here, all a very flat cornea, 40, 39. So most probably, myopic LASIK has been done, and you can see that the axis of the cylinder is not even. There's irregular astigmatism in this patient. So when you see maps like this, you're likely to make correct decision about whether you want to talk to them about a multifocal lens, or you want to talk to them about a toric lens or a standard lens. So when the data comes to you, you can straight away confidently talk about the options to the patient. So all these slides are based off a study done by Douglas Koch, Lee Wang, and his co-workers, and they took up 150 patients and they compared a standard Schleimflug tomographer with the central topo. And the three researchers who are all good with corneal work, they compared the two and they decided what kind of decision they'll make on these eyes. And read this, the same decision was made whether to recommend a premium IOL based on CT, central topo, in 75 to 97% of cases. So some of the doctors in the team made a mistake in 25% of the patient, while the more careful ones made a mistake only in 3% of the topos which they reviewed. So central topo is a very, very good screening procedure which doesn't add to the time. Now, though central topo is a wonderful paid feature of the IOL Master 700, I like this particular feature better. Not much has been talked about this. All these are posterior polar cataracts. So the IOL Master gives this kind of a lens picture. It's an anti-segment OCT picture of the lens, and in this you can see a clear curved posterior capsule. So when you see a clear curved posterior capsule like this, you don't have to discuss the risk of PCR and vitrectomy and all that. You can go ahead with your standard phaco. Now, once in a while, very rare, once in a while, you'll see a lens with, see the posterior curvature is not normal. There's some kind of thinning, weakening, and bulge. See this. There's a small tear in the posterior capsule. This patient developed a mature cataract after several anti-VEGF injections. He just came to me with a mature cataract, but this was picked up by the optometrist. So this kind of data is really useful because you can plan your surgery and what you tell the patients with this. So if central topo is very good if you have a large refractive practice and if you have sufficient volumes, and I wish they will give it free with each IOL Master 700, but it's a good add-on feature. I think my 8 minutes should be up long time back, isn't it? Thank you. Any questions, please? You're talking about the central topo? You're talking about the K from the central topo? So the way, yeah. So the way, this is a screening tool to tell you, normal, do whatever you like, or abnormal, please evaluate these eyes further. So it is just a screening tool. The data from this is not used for the calculation.